drug presentation of phenobarbital by Seth and Sam Behm. So this medication is going to be used alone or with other medications to control seizures. Controlling and reducing seizures lets you do more of your normal daily activities and reduces your risk of harm when you lose consciousness, and it will lessen your risk for a possibility of life-threatening condition of frequent and repeated seizures. Phenobarbital is used by people with seizures, anxiety, and also insomnia, and how you would get it is going to be prescribed by the doctor.
So the class of the drug is it's barbiturate, anticonvulsant. Dosage is based on the medication condition, phenobarbital blood levels, and response to treatment. Dosage in children may also be based on weight. Doctor may start this medication at a lower dose and gradually increase it to prevent the negative side effects. Administration: this drug is taken by mouth or with or without food, usually once a day at bedtime for seizure control or as directed by the doctor. Take with food or milk if stomach upset occurs. If using the liquid form of this medication, measure the dose carefully using a special measuring device.
So the mechanism of action is the phenobarbital works by increasing the amount of time chloride channels are open, in which turn it will depress the central nervous system. The pharmacokinetics of this is phenobarbital has an oral bioavailability of about 90%. The peak of the plasma concentrations are going to be reached about 8 to 12 hours after oral administration.
Precautions, contradictions: phenobarbital may be habit-forming. Tolerance and psychological and physical dependence may occur with continuing use. Phenobarbital should be administered with caution, if at all, to patients who are mentally depressed, have suicidal tendencies, or a history of drug abuse. Elderly or debilitated patients may react to phenobarbital with marked excitement, depression, and confusion. In some persons, phenobarbital repeatedly produces excitement rather than depression. Phenobarbital is contradicted in patients with known phenobarbital sensitivity or a history of manifest or latent
pormorphia.
Patients should be monitored while on this drug and watch carefully for the side effects.
There are special considerations while taking this drug. You're supposed to watch for side effects and go in and see your doctor immediately if there's any indication of any sort of addiction at all or any really bad adverse drug reactions. And then on the other side, we listed some of the adverse drug reactions like dizziness, drowsiness, excitation, irritability, aggression, confusion, lots of headaches, tiredness, loss of appetite, nausea, vomiting, and maybe some constipation as your body adjusts to the medication.
So the indications: sedatives, hypotonics for short-term treatment of insomnia, since they appear to lose their effectiveness for sleep induction and sleep maintenance after 2 weeks. Anesthesis, long-term anticonvulsants for the treatment of generalized tonic, clonic, and cortical local seizures, and in the emergency control of certain acute convulsive episodes,
epileptics, meningitis, any toxic reactions, just anything along those lines. So the first study that we did, that we looked at, was the current status of epilepsy treatment and the efficacy of standard phenobarbital therapy in rural areas of northern China. So the effective rate of phenobarbital was around 64% after the first month, but it increased to reach about 67% after the first 12 months of taking the drug. Most of the adverse effects were present early on in treatment, but they weren't as prominent later on. And most patients had their seizures under control with, on average, 60 milligrams of the phenobarbital.
In the second study, it was just a comparison of phenobarbital and some other treatments such as TMP for children with epilepsy. Phenobarbital has been the long-term go-to drug for epilepsy in the past century. But comparing phenobarbital to other current medications, I mean, it's had pretty much the same effects, but there is a little less side effects with some of the other drugs, such as TMP, which they've kind of directed more of the prescription towards those kind of medications.